Doctor
Hi,
Gaile,
Anton.
good
Good
morning. Good
morning.
morning. Yeah, interesting conversation today about skincare. How's your quarantine so far?
Okay naman, actually, yung kids, we try to keep them entertained kasi siyempre, alam mo naman mga kids, 'di ba? Short
Oo.
attention span, tapos laging gustong nasa labas. I'm sure you can understand. So we try to make activities for them. Well, actually, more of my husband. They've learned to play the ukulele, nagpe-paint na din
Ah,
sila. Mahirap ha, it's hard to keep them busy. But yun na nga, last week, finally, nakalabas na sila. O, di ba? Tapos,
oh,
tuwan-tuwa
wow.
sila makakita ng mga puno, tapos, mga cars, mga
Oo.
cats, ganyan. What about you guys? At least, I see, we live in a condo kasi so it's harder. It's more
Oh,
difficult.
I saw you guys went to Legazpi Market, tama ba?
Yes.
How
Kami
was
lang
that?
yun, kami lang. Well, yun na nga, it's not 100% of course as expected. I would say
Mm.
maybe 50% of the stalls are open and siguro yung mga tao hindi pa rin sila masyadong sanay to go out. So, but okay naman. I went also to Salcedo Market last Saturday. It was
Na, okay.
more, mas alive siya and mas maraming stalls. So, hopefully next week maybe um, will be more open. What about you guys? Yung Mercato, are you in operation? No?
Hindi. Wala na kami dun eh.
Ay, sorry.
We're here in Laguna. We're here in Laguna. And we're just staying here lang naman. Sorry, sabi. We're here in Laguna and yun, hindi kami makalabas. Sometimes you
Oh,
go down. So right now we do a lot of streams recently because we want to know more information about a lot of stuff. So this
mm,
one is a particular interest topic. I think a lot of people are asking also about skincare in
mm,
particular. Um, pero a lot of people are parang afraid to ask it.
mm.
So thank you for agreeing to do this conversation with us. Let's
Oh,
just
thank you for
wait for it.
inviting. Oo nga. Actually, I've been watching a lot of your live stream. Very interesting talaga. Eh, ako mahilig ako kumain eh. In fact, during the quarantine, hindi naman ako nagluluto, only my husband.
Oo.
We really order. And my sister-in-law, you know, Tina, di ba? Hilig magpadala ng
Yes.
pagkain. And
Oo.
ako, every time I want to check out, say, a resto or a new type of food, I really check out your blog. I
Wow,
I
thank
I
you.
I read it. Kasi ako I'm a reader eh, I'm more a reader than a viewer. So I like reading. So I really
Mm.
appreciate your blog.
All right. Thank you. All right. Let's start. It's 10 o'clock and we'll discuss skincare essentials and problems. All
Okay.
right. Thank you. And we're here talking to and thank you for All right. Good morning. Good morning. Good morning, Dr. Gail. Dr. Gail.
Morning, good morning.
And good morning to if you're watching this on the replay or watching it live now, please continue to join our discussion. Put your questions or suggestions or comments in the comment section below, so that we can include it in our discussion, or we can answer it after. If you're watching this on the replay.
Mm,
So we are talking about skincare essentials and problems during lockdown, and
mm.
we invited our friend Dr. Gaile Robredo-Vitas to talk about this topic. Dr. Gaile, maybe can you just introduce yourself
Sige.
and the things that you do?
Okay, so yes, as Anton said, my name is Gail, and I'm a board certified dermatologist. So I've been in practice for about 7 years now, and my interest includes aesthetic treatments, lasers, injectables, and everything. And I have two clinics in BGC and Makati. And yun, I was telling Rachel and Anton that just recently I started my YouTube channel. So please support. It's called Dr. Gaile Robredo-Vitas. It's where I like to talk about skincare issues, skin issues, and it was anything about the skin. So, and I'm very
And
excited and I'm honored to be invited by Anton and Rich because I really follow their blog and I watch their videos. So, medyo nakilig naman ako that they asked me to join them.
all right, thank you, thank you. No, it's our honor of game.
Oh, game.
Let's talk about skincare problems first
Of course.
during the lockdown.
Sige, oo. So,
So, ano, ikaw ka?
ayun. So, eto, totoo 'to ha, because while on lockdown, a lot of the people na parang wala namang problems, maganda naman yung skin nila, they've been texting me and in the beginning akala ko parang wala lang and then padami ng padami and they're experiencing the same issues. So, meron nagkakaroon ng skin irritations, nagkakaroon ng breakouts, and because of the constant, wearing of masks, yung iba biglang nagkakaroon ng mga sugat-sugat. So, I tell them, first yung skin irritation, especially hand eczema. Kasi 'di ba hugas tayo ng hugas ng kamay. We always wash our hands. If not, we disinfect with hand sanitizer. We use to clean we use Clorox or bleach to clean our surfaces. So, isa yun sa mga common problems. And one way of handling that, of course, is to limit hand washing only when you need it. Kasi, syempre ngayon, we're so conscious, we get so tempted na parang each time na lang we reach out for alcohol or we wash our hands. So, one way to minimize yung irritation is to limit your hand washing only when you need it. So, when your hands are dirty, after you use the toilet, before you eat, ganyan. And to moisturize afterwards. And it
Ayun,
also helps. Oo, yun. Important yun, moisturizing.
may tanong si Tina. Hi, good
Ay,
morning,
okay.
Tina. So what is the best
Ayan, ayan.
moisturizer for the hands?
Okay.
Which is
Yun.
related
So,
to what you're saying.
oo nga. First of all, yun, yung what you use to wash your hands should be medyo gentle. Wag na kayong gumamit ng mga detergent, ganyan. Kasi very, ano talaga sila, very strong. And then ako, I like to use creams that have barrier repair capabilities. So, it can
Hmm.
be yours. Petroleum jelly if gusto mo lang ng parang simple lang. Or ako, yung mga zinc oxide, titanium dioxide creams. And what I do at night, bago matulog, kasi wala ka na namang gagawin, di ba? I really coat my hands in these barrier repair creams overnight. Para pag umaga, pagising mo, parang refreshed na ulit siya. So, that's one.
Ano yun? Ano yung barrier repair cream?
So, ako personally, I prefer certain like brands. Can I mention brands ba?
Yeah, of course, yeah.
Yeah. For example, yung Aven na sickle fat. And then recently, Cetaphil came out with their own barrier repair cream. Mostela also has. So yung mga ginagamit na pang diaper rash, actually okay siya eh. So if you have kids and you have extra
Wala na
diaper
kami.
rash creams, wala na. Wala na. Kasi yung mga moms dyan, sila pa naman yung medyo sobrang conscious, di ba? They always like to wash their hands. So if they
Yeah.
have yung barrier repair cream or diaper rash cream, those are excellent, excellent creams to apply on the hands. And yung
Oh.
mga hand cream, yung Korean stores, they sell a lot of hand creams. Those are also good.
Oh.
Mm.
Basta may barrier
O basta cream-based.
cream. Okay. Nice to
Okay.
know. What about the face with the yung sa mask? Kasi may friend din ako sabi niya, actually hindi ko na-experience kasi hindi kami masyado lumalabas. So
Yes.
siya, lumalabas siya. Sabi niya, nagkakatigyawa, rashes. So how do you, syempre, kailangan nila magmask. So how do
Yes.
they repair it? What's the remedy for that?
Oo nga. So yun, new normal na nga daw ngayon eh. Parang, actually, hindi na kami makalabas ng bahay ng walang mask. Parang kulang, di ba? Because it's a requirement and of course, it's used to protect yourself. Kaya lang, the downside lang kasi of always wearing mask is that pag may nakapatong sa face mo and it's kind of occlusive, nagkakaroon ng parang trapping of the moisture and syempre yung saliva mo, kung sasalita ka, naiipon siya, nagkakaroon ng build-up of sweat. And sometimes when you're wearing tight masks, like yung mga frontliners, they wear mga N95, the pressure and the friction, lahat to, nagpapatong-patong and lead to skin issues like your breakouts, kasi syempre may bacteria. And yung mga may existing conditions na nakokontrol nila before, because of wearing masks, nag-flare up yan. So, unfortunately, medyo matagal pa tayo magsusuot ng mask and we really have to learn how to deal with it. So, what I tell my patients who experience these problems is first, you have to prepare your skin. So, how do you prepare your skin? siguro ngayon, minimize na muna natin yung paggamit ng makeup if hindi talaga kailangan. Kasi, syempre, pumapasok yan sa pores natin pag na-occlude. Also, avoid na rin muna siguro using yung mga harsh ingredients and doing procedures like mga chemical peel, ganyan. Kasi syempre, tinatanggal yung top layer of your skin. And prepare your skin by using mild and gentle cleansers and apply a protective moisturizer to preserve your skin barrier and protect against friction. So, yun yung pinakauna. So, ako, bago ako lumabas, kasi syempre, nagki-clinic ako, di ba?
Oo.
After I clean my face, I apply a moisturizer to protect my skin before I wear a mask. And then, since kami sa clinic, di ba, when you're dealing with patients, you're not supposed to be touching your mask or removing it. So, talagang andyan siya the whole day. And mapapansin mo that when you get home, ako when I get home, talagang ito ang oily na, tapos ang dumi-dumi na. So, when you get home, it's very important to double cleanse. Diba? It's a Korean routine. You remove with yung makeup cleanser and then you wash your face with your gentle cleanser to remove the buildup of debris, oil, yung dirt. And then, you then apply ingredients that restore, replenish, and hydrate, and repair your skin. O, di ba? Ang
Oo
dami.
nga. Can we can we talk about brands or
Brands?
I mean
Okay lang.
what you use or recommended brands?
Sige. So, in preparing my skin, so syempre, you try to use mild cleanser. So, when you say mild cleansers, yun yung mga soap-free na pag ginamit mo sa mukha mo, after mo maghugas, hindi siya yung parang banat na banat. So, meron namang mga soaps that are neutral. So, I always say you can go for like maybe Dove or Dove Sensitive or Oilatum, ganyan. And then, in mga drugstores,
Perla.
Perla pang damit yun eh. But actually, speaking of Perla, you can use that to wash your mask. You can use that to wash your
Yes,
mask.
I
Diba?
do.
Kasi wala siyang masyadong residues. And then, syempre, I'm sure you're familiar with like, say, Cetaphil, facial gel. You can also use Ceradan. So, Aveeno, all of those mild cleansers that when you use on your skin, hindi yung parang banat na banat yung feeling mo. Those are good because they don't strip your skin of the acidic mantle, which is essential to protect our skin. So that's number one. A protective moisturizer can also be from any of those brands, usually cream-based, and you look for ingredients like ceramides or colloidal oatmeal, yung mga ganon, hyaluronic acid. So those are the protective ones and anti-inflammatory ones. And then again, at night, you can add other anti-inflammatory creams like your niacinamide. I like using vitamin C. I still stick to my retinol kasi iba parang, paano yan, Doc? Baka hindi na ako pwede maggumamit ng anti-aging kasi because of the masks. You can still do that, but you do it at night para at least hindi siya nakaka-irritate in the morning. Parang, kasi syempre kailangan natin ng anti-aging, di ba? Malapit na ako mag-40. Kailangan na mag-anti-aging. Ayun, and then, it's at night where I really apply my creams and then tinutulog ko siya. So, yun, mga. Tapos, you were asking, Rach, about acne, diba? So, yung mga nagkakaroon ng, we call it maskne eh. May invento na naman na bagong term, maskne.
Is mask ni.
Oo. In fact, nasa Urban Dictionary na siya ngayon, maskne or acne caused by mask.
By mask.
You can do spot treatment. So, there are products in the market that contain 2% salicylic acid. So, pwede mo siyang ilagay dun sa mga areas na may pimples or products that contain benzoyl peroxide. They're over the counter. So, when you experience yung mga small breakouts, you can actually buy those from, I guess, like Watson's or Mercury, and then you can just put them there. But yon, of course, kung sobrang lala na, like yung mga flare-ups ng rosacea, acne, I still advise you consult your dermatologist. Kasi sometimes, pag medyo grabe na, yung over-the-counter products really aren't enough.
Now, question related to that. Is it safe to go to your derma now, or do you do teleconsultation, or paano ba? What happened after the quarantine?
Ayun, actually, I'm sure lahat tayo nakaka-relate. No one really prepared for this, diba? Parang bigla na lang, okay, bawal kayo lumabas, close everything, ganyan. So, in the beginning, syempre, we were scrambling. We didn't know what to do kasi before COVID, we were texting our patients already, but it's just to like follow up or schedule or ask questions. But now kasi syempre meron pa rin nagkakaroon ng skin issues and they don't have a way of going to the doctor. So it probably took a good 2 weeks before my colleagues and I were able to sort of set up our own teledermatology medicine, whatever you call it. So there are platforms that some of us use, but ako in particular, hindi kasi ako masyadong techie. Like, for example, itong chat na to, I had to ask my husband to set it up. I use Viber and Facebook Messenger. So, I use this app or, ano matawag doon? Software called Forms. And then I send them to my patients. They fill it up. I receive it via email. And then we schedule. So, it's either Viber chat, not WeChat, Facebook Messenger, or WhatsApp. So parang ganon. And then we talk like this, yung parang ganito. And then kasi kailangan makita eh. Our specialty is very visual. So sometimes pictures are not enough kasi syempre hindi mo mahawakan eh. Ako I like touching my patient's lesions but since bawal nga. So video para ma-close up, ganyan. And then, syempre, after that, after assessment, then I give my recommendations and then we send e-prescription. Ngayon kasi tinatanggap na siya sa drugstores eh, yung e-prescription.
Oh, that's nice.
Yeah.
Finally.
I know, right? This had to happen bago nila maka-move on sa ganun. But now, beginning May 18, we got, our society, the Philippine Dermatological Society, we got a memo from DOH and DTI that we were allowed na to open. Actually, even during the ECQ, board-certified dermatologists in the hospitals were allowed to practice naman. But yun, medyo syempre worry kasi we didn't really know eh. We don't really know a lot yet about this what we have now, this COVID-19. So everyone medyo, pag non-emergency skin condition, syempre we tell them just stay at home and just consult with us online. But of course, meron pa rin mga emergency skin conditions na kailangan talaga i-attend to. So May 18, ako at least in my clinic, we opened May 18. We started first every other day, tapos shortened hours kasi wala pang transpo. So what I did with my staff, I bought them bikes so they can go to work na nakabike.
Nice.
Nakakatawa kasi yung staff ko, sabi nila papayat daw sila. So parang win-win situation. Yun, so and then ngayon when it became GCQ, naging everyday na kami but still shortened hours because I want my staff to be able to go home na maliwanag pa kasi nagbabike lang sila. And syempre in the clinic, we had to prepare. I'm sure you've probably seen what Dr. Bell and Dr. Ivy did to their clinics. So parang ganun na rin yung ginawa namin. We set up like barriers, acrylic barriers, covered our beds with plastic. We have automatic alcohol dispensers. We have air purifiers. We have UV lamps. And then yung staff namin naka-isolation gown. It's really we had to prepare for a long time before. And padagdag siya ng padagdag, parang on our first day, nako, kulang ng ganito. So now, I've been on my, fourth week na pala, grabe yung bilis. I've been on my fourth week in operation, di ba? We've only started doing facials this week kasi before that, it wasn't allowed yet. But yun, syempre, we try to put acrylic barrier between the facialist and the patient kasi hindi ka naman pwede mag-facial ng nakamask, kailangan tanggalin mo, di ba?
Oh, yes.
Oo, kasi, so yun. And surprisingly, ang daming gusto na magpa-facial. Parang, na-excite sila na parang, oh my God, pwede na mag-facial. But yun, it's still a work in progress kasi syempre, kailangan mag-ingat, both patient and our facialists. And before, now it's only by appointment. We don't accept walk-ins.
No walk-ins.
Oo, kasi we don't want them to wait in the waiting area for their turn. Parang mas maganda pagdating nila, it's sila na. And I send them an electronic form, a questionnaire. Diba? Parang, I'm sure naka-experience na kayo noon, di ba? Yung tatanungin ka if you have symptoms.
Oo.
So, I
Yes.
send it electronically because I don't like wasting paper kasi pagkatapos natapon mo lang. So, before they set their appointment, I send it electronically. They answer it. And if there's one question there that's yes, then we delay the appointment. But everyone has been really cooperative and receptive and really appreciate it.
Para
So, ayun.
magpa-facial, 'di ba? Bawal
Wow.
ma-late. Hindi sila nale-late, I'm sure.
Actually, hindi, maaga pa nga eh. Kasi ina-anticipate nila yung traffic. So parang, Doc, sorry, 30 minutes ang aga ko kasi walang traffic. Kasi we're so used to, di ba, dati, 1 hour. Ngayon, parang 15 minutes, andun ka na. So, mabilis lang.
Wow.
Oh, I
All
also
right.
wanted to mention pala, um, other reasons kung bakit we experience breakout. Kasi iba naman parang, Doc, nasa bahay lang naman ako, hindi naman ako nagmamask. Why am I experiencing skin issues, breakouts? Other reasons kasi, I'm sure you might be able to relate to it. It's because syempre stress. Na-stress tayo because syempre bago to eh. Hindi natin alam what to expect. So, stress of course cause changes in our body and sometimes they cause exacerbation of existing conditions. Number two is, ito sobrang guilty ako dito, unhealthy snacking. So ako, it's so easy to reach out kasi for those chips, chocolates, and di ba, like ako hindi ako marunong magluto talaga, hindi ako nahihiya aminin. So,
Tsaka
canned goods,
sister-in-law,
yun
because
talaga
of
yung,
the sister-in-law.
oo, yan, si sister-in-law mahilig magpadala. Ay, hindi, healthy yan eh. Ako pa nga yung nagre-request na magdala ng mga junk food eh. But yun, chocolates, chips, yan, weakness ko talaga yun eh. So, when you eat a lot of those, talagang nagkakaroon ka ng mga breakouts. And of course, sleeping late because of Netflix. I'm sure kayo, nanonood din ba kayo ng Netflix? Na
Oo.
Netflix, syempre, sometimes until 2 a.m., 3 a.m. And then, pagising mo, ayan, may pimple ka na, ganyan. And finally, one of the biggest, most important and reason why nagkakaroon ng mga breakouts is because we tend to forgo our normal skincare routine because we feel na parang, sa bahay lang naman ako, hindi ako nagme-makeup, hindi ako lumalabas. So, why do I need to clean my skin? But in reality, even when you're at home, you still get the buildup of your dead skin cells. Syempre, may dumi pa rin, and oil, and sebum. And when you don't remove them, they accumulate on your skin, and eventually, they can end up as breakouts. So, yun.
Okay.
Skincare is very
Great question.
important.
Yeah,
Yes.
before we go to the routine, Rich.
May question pa ako. 'Di ba hindi yung sa mga pimples, hindi lang naman sa face, sa katawan din, 'di ba? So
Yes.
pareho lang din 'yan because of the stress, the way you eat, no?
Yeah, and 'di ba sakto yung COVID tumama siya summer. So sobrang init.
Yeah.
And usually especially yung chest and back kasi natin, it's very rich in oil glands as well. Not as rich as our face, but marami din siyang oil glands, and they also tend to get occluded, especially pag pinagpapawisan ka, tapos yung dirt, ganyan, and nagiging blackheads, whiteheads, and pimples din siya. So, ganun din, same treatment, clean, exfoliate, ganun. We'll talk about it later when we discuss the skincare essentials.
Yes. May question si Tina.
Okay. Is a face mask and a face shield really necessary? Well, yun, we have to understand kasi the purpose of wearing masks. Diba? Meron niya akong ginawang video na yan sa channel ko. Yak siya pinag-vlog. But we wear face masks kasi to protect, not only to protect ourselves, but also to protect others. Kasi, di ba, sabi nila, when this condition that's going around, di mo naman alam when you have it or not because a big percentage are asymptomatic. So, you wear masks to protect yourself and also to protect others just in case meron ka din. Kasi the way you transmit this condition is via droplet eh. So, it's really your saliva, your aerosols from your mouth and your nose. So, wearing mask will prevent those aerosols from coming out. Ngayon, yung face shield, kasi sabi nila, it's not only through your mouth and nose that you get the aerosols, pwede rin siya sa eyes mo eh. So, ako, I wear face shield or goggles to prevent yung aerosols from getting into my eyes or my face and then eventually mahawa ko. Parang ganon. So, it also prevents you from touching your face. Pag may nakaharang kasi, di ba biglang, ay, pag nahawakan mo, ay, may nakaharang. Kasi ako, I like to touch my face eh. So, wearing face shield protects you from touching your face and from the droplets from getting into your eyes and other parts of your face. So, is it necessary for you to wear both? In certain conditions, yes. For example, ako, close proximity to a patient,
Let's
diba?
wait.
So, harapan, and when I do my procedure face to face, kailangan ko mag-wear ng goggles or face shield plus mask to protect myself. Especially when I do procedures that the patient has to remove the mask or wala siyang suot. So yun, and in salons, kailangan din face shield and mask kasi lapit mo din sa patient eh. And then when I
Yes.
guess food preparation, kasi syempre you wanna protect the patient, di ba? Kasi yung sweat mo din, syempre you don't want your sweat getting into it. So yun, there are, like for a normal person na lumalabas, I don't think you need to wear a face shield. But mask is okay. But in certain, I guess, conditions and occupations, kailangan talaga siya.
Okay, that's good. So, question lang on COVID and skincare. Is there any relation o wala naman?
Actually, surprisingly, maraming skin manifestations ang COVID. And in our society, we've been passing a lot of journals around. Kasi originally, we thought that it was just a respiratory condition, di ba? Parang pag may ubo ka, ganyan yun na yun. But more and more, we're learning about it. It's actually a systemic condition. And some patients who get afflicted with the condition manifest it in other ways, apart from cough or colds. I've had patients na they experience rash all over the body na parang hindi nila ma-explain kung ano. And in other journals and experiences shared in other countries, some finger lesions, marami din skin manifestations. So, yun na nga, parang ngayon, we're still all learning about it. Diba, yung iba nga, diarrhea, yung manifestations nila. Yung iba naman, muscle pain. So, it's really, it's a virus that I guess spreads all over the body. It's a systemic condition that gets into your body via your respiratory tract. So, everyone is still trying to learn. We keep ourselves updated by attending webinars, reading journals, kasi we never know. This is new to everyone. So, yung maganda na lang ngayon because of technology, we are able to share with our other colleagues abroad kasi iba-iba yung experiences natin eh. So, yun. Lahat tayo natututo pa.
So, when you go to the clinic, do you need to have test ba? Or hindi naman? You just need to have proper safety procedures?
Ako, in my clinic, if you come for consultation or like facial, I don't require a rapid test anymore. As long as you answer truthfully the form that I gave, the survey. But in some patients who require certain procedures that will extend more than 15 minutes, I ask them if they are willing to do rapid testing. Also, to protect us, kasi syempre, we'll all be exposed. And some of them naman are more than happy din to know. And parang na-appreciate pa nga nila. Parang, oy, you do that pala in your clinic. Parang, di ba? You of course, they understand that we want to protect them and everyone else and all the patients who come. Kasi syempre, may mag-positive lang ng isa, kukontakin mo na lahat na nagpunta doon. And then, of course, all of my staff have to be quarantined, ganun. So, yeah, but I don't require it for all. Not for all.
All right, that's good. Any more questions? I guess let's go to the skincare
Essentials.
essentials. Ano ba yung mga kailangan natin during this quarantine? And hahaba pa siguro itong lockdown na to. So,
Oo nga eh. Well, kayo ba, question lang, ay masipag ba kayo to apply, to do your skincare? Kasi parang, si Rach, ayun, ang ganda-ganda ng skin, no? Glowing. Ganito, hindi ko makita kasi may mask. Pero, ayan, mukha naman wala kang breakout.
Honestly, hindi.
So, good genes lang yan. Good genes.
Siguro.
good husband. Good husband.
Good
Wala raw
husband.
stress.
Wow.
Kita sa buhok.
Oo nga, isa pa yung buhok na yan, gumupit ng buhok ko sa husband ko eh, kasi wala pang salon. Ang haba, parang walis na yung buhok ko eh, but yun.
Oo.
Ayun,
So
so,
ano ba dapat, Doc? Ano ba dapat, Doc, ang ginagawa namin?
ayan,
For
so,
ano ba yan? For men and women ba yan?
yes, for men and
Okay.
women, ito, I'm going to discuss the essentials lang. So, this is something that everyone should be doing, including the both of you. Kasi I understand, sometimes tamad na din akong mag-skincare, pero I guess since it's what I do, I'm forced to do it and I started to enjoy it na rin. So, first skincare essential is cleansing. So, cleansing, even if you don't go outside, even if you don't apply makeup, is very important because cleansing removes yung buildup of your dead skin and dirt and sebum that accumulates throughout the day. So when you cleanse, make sure that you use mild cleansers, gentle cleansers, like the ones I mentioned earlier, na hindi tinatanggal yung essential lipids that protect our skin. So wash your face once or twice a day with a soap-free cleanser, one that cleans while it protects and preserves. So ako, sometimes in the morning, I just wash my face with water, but definitely in the evening, I make sure that I wash my face. Number 2 essential is exfoliation. So, yung exfoliation, dati hindi ko yung ginagawa, but as I got older, I noticed more that my skin would get dull, tapos lackluster, parang hindi na siya buhay. Exfoliation kasi aids in removing all the dirt and debris na pwedeng naiwan after you wash your face. But you don't have to do this naman every day. Ako, I exfoliate maybe once or twice a week, okay na yan. Kasi ayaw mo din naman na talagang sobrang tanggalin yung ano ng skin mo. And you can choose between a physical exfoliants, like the scrubs that you can buy from your drugstore, or you can use chemical exfoliants that you can find in your toners, yung mga may alpha hydroxy acid, beta hydroxy acid. So you can do that. Just make sure that you don't overdo it and you listen to your skin. Malalaman mo naman kung hindi sa'yo hiyang kung sobrang humahapdit, masakit, ganyan, or namumula. So, yan, that's number 2. And with exfoliation, it's very important that you find one that works on your skin. So, normally, after 3 or 4 applications, malalaman mo na kung hiyang siya sa'yo or hindi. And number 3, very important, is applying sunscreen. So, ito, alam ko, a lot of people, especially during the lockdown, finorgo nila tong step na to eh. Huwag na tayo mag-sunscreen, wala naman tayo sa labas eh. But actually, when you're indoors, and yet you have a window, yung UVA, nakakapasok pa rin siya eh. So, hindi ka man iitim or you don't feel the burn, you can still age. Kasi UVA is the aging ray. So, yun. And then, tayo, we like to be on our phones, we like to be in front of our screens. Blue light, which is also known as high energy visible light, can penetrate our skin even deeper than UVA, and prolonged exposure can cause pigmentation and aging as well. So it's very important to apply sunscreen even when indoors. Ako, I use a lightweight sunscreen or moisturizer with an SPF of at least 30. And I reapply siguro, I apply in the morning and then I reapply in the afternoon. Kasi yung ibang patients ko nagsabi nga na parang, Doc, bakit nasa loob naman ako ng bahay, parang mas naging pronounced yung freckles ko? It's because they didn't apply sunscreen and yet they would stay in their balconies or they would, be on their screens. So these also can cause pigmentation and aging. So very important pa rin to apply your sunscreen. And then finally, step 4, essential 4, is nourishing your skin with moisturizers that contain ingredients that will benefit your skin or will address your skin issues. So it can be moisturizer with your antioxidants or vitamin C. Ako, I really, retinoids are my go-to ingredients. So I never forget to apply my retinol at night. So yun, those are the 4 lang. 4 lang yung kailangan mong gawin. Cleanse, exfoliate, sunscreen, and then moisturizer with your ingredient of choice. So, yun lang, 4.
Yung sa moisturizer, 'di ba may cream, may
Mm.
oil, 'di ba?
Yes.
Anong yung when you apply those, depende sa skin mo rin, di ba?
Yes,
Or
oo.
depende sa weather?
Both
I
yan
mean,
actually. Kasi ako, yeah. So both yan. Ako kasi, I have dry skin to combination. So like you said, tama, depending on the weather, sometimes oily siya sa T-zone, sometimes dry. So usually for patients with or individuals with dry skin, I would recommend that you opt for cream-based formulations kasi sila yung nagna-nourish and moisturize ng skin. For oily and acne-prone naman, you should go for gel-based or water-based or lightweight moisturizers. Kasi if you apply yung medyo thick, it can contribute to clogging of your pores and eventually, pwede ka mag-breakout. Tapos doon naman doon sa mga sensitive skin naman na individuals, syempre medyo you opt for the hypoallergenic types, the fragrance-free types, and those with minimal preservatives kasi nga sensitive skin ka. But yun, ako, like, buti na mention mo, madami akong moisturizers. There are moisturizers that I use. Di ba when you travel to cold countries, biglang, uy, di na ako oily, dry na ng skin ko. So, iba yung ginagamit ko for that. Usually, mga balms and cream-based formulation. And
serum.
then, oo, yun. Pag summer naman, di ba parang, oh my God, sobrang oily ko. So, I opt for gel-based and water-based moisturizers. Pero yun,
Mm.
important yun.
Oh, may nagpapatanong lang kasi
Okay.
yung sa 'di ba you said facial wash. Some
Yes.
people use feminine wash. Is that okay or hindi?
Well, feminine wash, like it says feminine wash there? Or yung
Oo, yeah,
brand,
may gumagamit kasi, oo.
Sino?
Hindi, may nagtatanong lang.
okay. I've never encountered that question before, but it's very interesting. Okay, most feminine washes have a pH of 5.5, di ba? So, theoretically speaking, our skin kasi has an acidic pH. Pag bineasure mo yung normal physiologic pH ng skin natin, it's
Mm.
5.5. So, theoretically speaking, okay lang na gamitin mo yung feminine wash on your face. Okay. Okay lang. Kasi actually, it's funny kasi maraming products there that are labeled for use, like for example, for body, for face, for yan. But actually, if you, theoretically speaking, pwede mo naman siyang gamitin. Like, palagi yung tinatanong, can I use my body wash on my face? Kasi nalagay body wash lang, pwede ko bang gamitin? Actually, pwede. Can you use your face wash on your body? Pwede din. Yung feminine wash, first time ko na-encounter yan, but I think, yes, actually, you can. Kasi it's 5.5. So, 5.5 is our skin's natural pH. So, pwede mo siya gamitin. But yun na nga, the moment na nag-react ka, tigil mo na lang. Kasi, di ba? But very interesting question. Hindi ko makakalimutan yan.
May nagpapatanong lang naman.
Kasi di ba minsan gusto mo all-in-one na eh. Parang, ito na meron ako eh. Gamitin ka na lang.
Or kung ano nandyan sa restroom.
Yeah. Oh, yeah. Yeah. Oo nga.
Okay. In terms of anong tawag nito? No, I'm interested kasi with brands eh.
Okay.
What kind of brands would you recommend? Kasi
Nako,
ano ba
sige,
yung
ma-brand yan eh.
organic brands? And maybe just a recommendation from you on the brands because I understand you mentioned a lot of the things we need to do,
Oo.
but ano ba yung mga favorite brands mo? Maybe you can share.
Okay, well, okay. Speaking as a non-dermatologist, kasi we're not really allowed to promote brands. But I'll talk na lang.
Ganun ba? Sorry.
I'll talk na lang
Ibig
based
yun?
on my own personal experience. So, as an individual, what I use. Not exactly endorsing it. So, I'm just gonna share na lang what I find effective on my skin. So, ayan. Like yun, like I said, I have dry to combination skin. It's crazy. Sabi nga ng husband ko, it's aging. Kasi parang hindi mo maintindihan, dry ka, tapos mamaya oily. So, I guess it's hormonal na rin. So, ako, pag pumasok ka sa dresser ko, sobrang dami kong brands. Because ako, I believe in brands because they do research and proper yung, packaging and everything. And, yun na nga, iba-iba, depending on what I need, madami. And I believe that a lot of brands are really good and it's very individualized. So I always tell my patients that what might work for me might not necessarily work for you. But ako, I go for, since I'm dry, I go for products with ceramides, hyaluronic acid, peptides, yung mga talagang nourishing and refreshing na brands. So, madami naman dyan eh. Like, yung local brands that I like,
Oo.
yung Human Heart Nature,
Mhm.
I like some of their products kasi nga they're very gentle and my kids are very sensitive and they easily react and hindi sila nag-react doon. My kids also like Cetaphil, madami sila eh, Johnson and Johnson. Pag nakita, and my mother-in-law and my sister-in-law, they like to give products. So, ginagamit namin lahat yon and they know that my kids' skin are very sensitive. Organic doesn't necessarily mean hypoallergenic. It's different. Some organic ingredients I find that are irritating on my skin. So, yung lagi kong advice is listen to your skin. I like Korean products kasi I'm dry. Korean products are very hydrating and very nourishing. And they're very gentle. Korean skincare is very gentle. To remove my makeup, I like using yung balm cleansers. In my videos, I show what I use. They're very, kung hindi ka naman mag-makeup, hindi siya masyadong important. But ako, I apply makeup kasi. And I find it necessary for double cleansing. Micellar cleansers are also my go-to to clean my skin, especially when I travel. Kasi di ba nakakatamad na magdala ng entire skincare routine mo when you travel. So, the micellar brands that I've tried, there's Bioderma. You can find it in like drugstores out there. And then Aven also has micellar cleansers. Recently, Safeguard came out with their micellar washes, and I've also tried it. It's good. I find that pag tamad na akong maghilamos, kuha ako ng cotton pad, micellar cleanser, apply, I put my moisturizer, and then I sleep. Kasi di ba when we travel, you're out the whole day. Pag uwi mo, gusto mo na lang matulog. Yun. So, I use that also. Ano pa ba? Retinol, madaming retinoid. Retinol is available over the counter and there are a lot of brands out there. Some of them I haven't tried because I stick to the ones that are branded that I have in my clinic. But retinol is over the counter and a lot of products, ano bang meron dito? I don't know what's out there. I think Olay came out with their own retinol product recently. And mga Mario Badescu, I think. I haven't tried those, but retinol is something that I would recommend everyone to use. Vitamin C as well. A lot of products out there have vitamin C. Depending on what you need, they come in percentages like from 10 to 25%. So, yun. I'm
May
nag-ramble na ba
vitamin C
ako?
lang ba? May vitamin C lang ba na facial ba? Ano ba 'yun?
So, okay, oral vitamin C, yung iniinom mo,
Sa
is
katawan
different
'yun.
from, it doesn't do much for your skin. So, if you want to put vitamin C on your skin, kailangan i-apply mo talaga siya. They come in different forms. May cream form, may oil, may serum. Again, it depends on your skin type. I prefer to use the serum oil-based vitamin C, but I like to mix it sa cream para it's easier to apply. Kasi the oil types can sometimes be drying. So, kung oily ka, weird no, oil type pero drying. Kung oily ka, pag nilagay mo, perfect siya. But since I have dry skin, I like to mix it with a cream-based moisturizer before I apply it on my skin. Actually, sobrang exciting ang skincare. Even ako ngayon, ang dami-dami ko talagang ginagamit. But, of course, I give it time. Usually, I allot 4 to 12 weeks for a certain product to know whether it's working or not. Kasi parang iba, you cannot say na, okay, nag-apply ako ng moisturizer ngayon, bukas ang ganda na ng balat ko. That's impossible. Hindi talaga siya, that's not how it works. You have to
Yes,
be
of
patient.
course.
Oo. Yung iba kasi parang, oh my God, may psychological effect kasi sometimes, diba? You apply it. Pagising mo sa umaga, feeling mo sobrang ganda na ng skin mo. That's not how it works. You really have to give it time for it to work and for you to be able to say na parang it's not working.
All right.
And then, of course, another thing, I encourage also for you to, go for in-clinic treatments because syempre, yung mga ginagamit mo sa bahay, of course, they're not as powerful as what we do in the clinic, especially with exfoliation, like our chemical peels and our laser treatments. Yung skincare products that you do at home, they're good to maintain. But if you really want to, I guess, institute significant changes in your skin and to maintain, it also helps to do skincare treatments and anti-aging treatments in the clinic.
That's why you're there.
Oo nga. Kayo kasi wala kayong problema. Ayun, kitang-kita, walang wrinkles. So, si Rachel tumatawa na. Marami pa ako wrinkles sa'yo. Oh. Wala,
Okay. With that note, can we have a photo lang? Let's have a photo.
Sige.
Nakakalimutan ko to palagi.
Oo.
Pero let's have one. Okay. 1, 2. Okay, one more solo. Solo lang.
Solo.
Kaya naman si Howard
Kasi, halika, sama ka sa akin.
Backward
Ayaw
mo.
niya, ayaw.
Okay, ikaw na lang. Okay, 1. Alright. One more. One last. All right. Maybe to end our conversation, I've checked your YouTube channel.
Yes.
It's quite interesting. So maybe we can talk about it. And a lot of the doctors are now doing YouTube channel. Can you say some more about bakit may trend na ganyan?
Well, ako kasi 'di ba, as doctors, when a patient comes, explain ka, dati kasi ginagawa ko parang search mo sa YouTube. Kasi, for example, may tatanong, Doc, how does chemical exfoliation happen? Or paano ba mag-laser? And then, minsan sinasabi ko, actually, i-YouTube mo, marami kang makikita. And then, one time, a patient came to me, tapos sobrang mali yung information na nakuha niya. As in, parang totally wrong. And then, I realized, parang sabi ko, shucks, hindi pala lahat ng pwede mo makita online reputable or reliable. So, nauna yan, I started making videos for my own patient's consumption lang. Parang, I play it in front of him in the clinic, para sa kanya lang, para kami lang, ganun. And then, yung friend ko, na doctor, was telling me, why don't you put it out there, para naman other people can also benefit from that. So, nung una, sobrang conscious ba, kasi when you know that other people are watching, parang nakakahiya, di ba? Parang, sabi ko, gosh, ang hirap pala to talk in front of a camera na wala ka namang kausap. Mahirap. So, if you notice, yung mga una kong videos in the channel, I was so self-conscious, I wasn't used to it. But then, with that in mind, I just imagine I'm talking to a patient, I'm explaining, medyo naging comfortable. But that's really how it started. So now, when I have a patient who asks about acne scars or like, ano ba yung mga nasa video ko, lockdown skincare, again, I refer them to my channel. Parang, you try to watch how to apply sunscreen, ganun. Kasi, para at least pwede na lang ulit-ulitin, they can go back to it. Kasi when I explain to them, like, face-to-face, minsan, di mo naman na kukuha lahat, di ba? But at least if there's a video they can refer to and they can watch, it's easier to go back to it. And yun na nga, parang, you get to reach more people out there. My aim is really to educate, kasi I think it's very important. Ang dami kasing misconceptions and myths out there. The internet is a very rich source of a lot of information and misinformation. So, my goal talaga is to sort of educate and to, contribute, at least share my knowledge, especially to those who cannot go to the clinics of dermatologists. But yun, syempre, I only deal with normal skin issues. I don't, of course, discuss like yung talagang diseases kasi those have to be dealt with in the hospital or in the clinic. So I hope that people find it interesting. Okay naman, nung una, syempre medyo kinakabahan, ganyan. But now, I just, it's the hardest actually is to think of topics to talk about. So if you guys have any recommendations or if there's any topic that you want me to talk about, I'll be very happy to make a video about it.
Do you so all of these are specific to skincare lang? You don't do lifestyle stories or feature clients also? Ganun.
In my YouTube channel, wala pa. It's really, I'm trying to focus muna more on the things that I really know. Yung alam na alam ko talaga, para kahit balik-balik na rin mo yung tanong, at least masasagot ko.
Comfortable ka.
Diba? But recently, because of yung situation nga natin ngayon, I made a video about wearing masks and hand washing. So parang ganon. So it really still involves the skin, kasi at least alam ko talaga siya. I haven't really tried lifestyle. Although, if you notice dun sa mga unang videos ko, I've incorporated some of my travel videos, but travel for work. So it's still related to dermatology. When I give lectures abroad, and it's my travel related to that. And yun, parang puro photos lang, and there's really not much explaining, and I found that it wasn't really effective. Parang hindi ako nakarelate masyado to audiences. So I stopped doing that. I focused more on education and really explaining. And that's what I think resonated more with my audience. So I'm still nangangapa pala. I started lang I actually started late last year around this time, but I really focused on it lang this year, like mga January. So I'm still learning. I watch a lot of channels to see how to really go about it. It's a learning experience. Maybe you can teach me. Hello?
Sorry.
Yeah.
And obviously, there's a lot of people following it. There's an interesting video on immune system and skincare.
Yeah.
Is there any relation? Can you boost your immune system with skincare?
Well, yung video na yan, yeah, it's not just about skin, but it basically talk about how everything, since our skin is the largest organ of the body, anything we expose ourselves to, anything we take, or anything that we drink really affects our skin. And there are some products that I give my patients, for example, zinc, selenium, and biotin ganyan, for the hair, skin, and nails, which can influence our health in a good way. So zinc is an immune booster. So yung mga patients na binibigyan ko ng zinc for their skin, it also helps boost their immune system. And also vitamin C and glutathione. So glutathione is an antioxidant that a lot of patients take orally. So it's very helpful when you're depleted. For example, yung palagi kang puyat, palagi kang pagod. So it helps to take antioxidants and supplements. Kasi ako, I don't know, I'm sure most doctors will agree with me, but supplements are not necessary. Kaya supplement lang siya, di ba? But since, di ba ngayon, iba na yung buhay natin sometimes we forget to eat healthy food, we forget to, take in the nutrients that we need, we reach out for whatever's available. So sometimes kulang. So those are the times that I really recommend that you take supplements. For example, yun, di ba, because of the quarantine, we're all locked in our condos or apartments. Swerte kayo kasi house kayo, you can go out. But like, for example, kami, hindi talaga kami nakatikim ng araw for a good 2 months. So, I usually advise to supplement with vitamin D. It's a very controversial topic. Some doctors don't believe it. But ako, I do. When I was locked up in quarantine, I took vitamin D supplements, and my kids drank a lot of milk kasi wala talaga kaming araw. So, yung mga ganon. There are other things also that you can do to boost your immune system, like sleeping enough, and of course, exercising, which I don't really do. But yun. So that video is about that. What you can do to boost.
I remember that yung skin ng girls versus sa female, male and female, iba.
Yes.
So,
Yes.
'di ba parang mas makapal sa kanila,
Yes.
parang gulong ba, parang
Oo,
So,
yeah.
the same din ba ang regimen sa kanila, yung skincare?
Well, yung sa male skin kasi, una like you said, tama, they're thicker. The pores are larger. And may hair. Di ba may mga hair yung lalaki? So, yung girls tend to be thinner, lesser oil glands, smaller pores. The essential steps are the same. But for guys, especially those with thicker skin and more oily skin, you might opt for products that target your skin type. So it's not only male and female skin that you should focus on. It's also skin type. Kasi meron din naman mga lalaking ang kikinis, ang ninipis, di ba? So, other than focusing on male and female skin, I think it's more important to focus on the skin type. So, kung oily ka, you should use products that are meant for oily skin, like gel-based, lightweight, water-based. While even if you're a guy and you have thin skin, dry skin, you should apply ingredients that are meant for your skin type. So, ako, it's more skin type rather than male or female skin.
Mm, okay. May question pala si Tina. Do you
Okay.
discuss hair care?
Yes, of course. Ang daming nanlagas ang buhok nung quarantine.
Oo nga. So, paano yan? Any advice?
So,
Pakalbo na.
when it comes to hair kasi or hair thinning, there can be a lot of causes eh. So hair thinning can be hormonal, yung what we call male or female pattern hair loss. So unfortunately, as some of us age, we might experience thinning of the hair because of our hormones. So yung mga lalaki, di ba, lalo na it runs in your family, you start to lose hair in the front or at the back, ganyan. So we call that male pattern hair loss. And yung treatment dyan is uh, uh, something that we give orally. It's called finasteride. So we give that orally, and you take it um, lifetime. So my husband takes that. And for female naman, it doesn't work for female. So for female, there are other treatments that we do in the clinic. Like sometimes we do, it's very controversial, but it works for some, it doesn't work for others. We do PRP injections. There's this new procedure that dermatologists and other practitioners started doing. It's called Regenera. So we harvest stem cells from your scalp and then we inject it. So marami naman treatment. So that's for female pattern hair loss. And yung iba naman ngayon, during quarantine that experience hair fall, ang dami. I must have done maybe at least 5 teleconsults on that, yung hair fall. Yung hair fall, we call it telogen effluvium, and usually can be attributed to stress, either physically, emotionally, or mentally. Yung mga nagka-crash diet, and then after giving birth. So that one, pag na-address mo yung cause niya, pag nawala na yung stress mo, okay ka na ulit, you started eating healthy, your hair will actually go back to normal. And you can make it go back to normal faster by using mga hair growing shampoos or taking supplements that contain biotin, selenium, and zinc. Parang ganun. So actually marami. And then meron din akong patients who have yung bald spots. We call it alopecia areata. So sometimes they can also be caused by stress. 40% of patients who actually get that, we call it idiopathic. Hindi nila alam, bigla lang sila nagkaroon. And then even if you don't do anything about it, bumabalik din siya. So what happens is that your body suddenly doesn't recognize your hair as your own and it starts attacking it. So nanglalaga siya. So then you have a bald spot. And then later on, pag na-reset na ulit yung system mo, tutubo na ulit siya. In some patients na marami, we do treatments. We do steroid injections to stop your body from, killing your hair or removing your hair follicles. And then we apply hair growing treatments. Parang ganun. So yeah, hair is a very common issue that dermatologists have to deal with. And yun, parang I really encourage other people or those who are experiencing hair problems to consult because we can really help you in that department instead of experimenting and trying out a lot of stuff.
All right. Hindi pa siguro.
O ikaw, Rach, ha?
All right. Thank you. So the cost ng teleconsult is the same as the cost of going to the clinic. Paano ba
Yes.
nangyari sa sa
Well,
industry?
ako, I charge the same. I don't really know. I know of some who charge less. I know of some who charge more. I think it's really up to the doctor. Our society naman doesn't set a standard as to how much you should charge. But I think it's really, they left it up to us.
Okay. All right. Thank you. We learned a lot. May
I
questions
hope
pa?
so. I hope so.
Oo, we learned a lot. Thank you for asking all our questions kahit na abnormal
Replying.
questions and replying to our questions. Thank you so much. Thank you, Doc. Thank you.
Nasasanay na ako sa live eh. This is probably my 4th pa lang na live.
Oh,
Masaya
okay
naman pala
na.
siya. Oo,
Yes.
okay naman.
Yeah. Most people watch it on replay anyway. So, and it's good. And you look natural nga eh. And online.
Thank you, thank you. Nasanay na sa teledermatology.
Tsaka sa YouTube
Diba? Oo,
channel.
Oo.
tama.
Okay. Thank
Okay,
you.
thank you.
Thank you, guys.
All right. Thank you. And we're here talking to Steve. Thank you for talking to All right. Galing, galing. Thanks, Thanks, Doc.
Yeah, I hope to see you guys soon.
Oo.
Kailan ba tayo
Again,
bababa?
after this.
Yes, yes.
Makati ka lang, di ba? I mean, yung bahay nyo.
Yeah, pero yes, yes. Nakakaingit nga dun sa province eh, kasi at least fresh air, a lot of trees, di ba? Dito
Sobra.
sa amin wala, condo, di ba? Oo. Province na ba yan? Hindi naman probinsya yan, sorry. Laguna, di ba?
Province.
Hindi, province.
Oo,
Province.
yes.
Province.
Namimiss ko na umuwi ng province eh.
Yeah. Okay yung YouTube channel mo ang galing. There's
Yay!
a lot of
Uy,
Gawan mo ng URL. May URL ka ba? Gawan mo ng URL.
Hindi ako marunong. But coming
Hindi,
from
gawan
you,
mo. Parang youtube.com/ ano bang gusto mo? Dr. Gaile? Ganun. Or Gaile?
paano mo gagawin yun?
You just need 100 subs. Marami ka na. 5,000 subs ka na eh. Para when you share, go to
Oo.
youtube.com/Gaile or something. Or
Sige.
whatever you want. Pero it's a permanent URL.
Oh, cool. Uy, coming from you, na-touch, na-flatter naman ako doon. Coming from you, you said that it's good. Thank you. Yay.
Oo, yeah. Especially the latest videos, okay na eh. Parang comfortable ka na sa sa
Oh, yung mga una, talagang shy pa.
Oo.
Yeah, shy.
Tsaka
May
it's
learning
prominent.
curve ka eh. May learning curve. It's hard It's hard to talk in front. Wala ako nahirapan ako to talk in front of a camera kasi syempre walang reaction. Ganyan.
But usually you really have to think of an avatar eh. Like in your case, a patient, 'di ba? That's asking.
Yeah. Oo nga.
And then parang you're talking to that avatar. So, I think you're getting it naman eh. And since you already have 5,000 subs, that's actually really good.
Wow, 5,000.
Kailan ka ba nagpa-publish ng mga videos mo?
Actually, yun na nga eh. Does it have to be scheduled ba? Kailangan ba consistent? Or ako
So
kasi
ito
parang
lang, kasi promising yung YouTube mo, the way to build it is you have to release every in a certain schedule.
Okay.
So it needs to be like every Monday or every Saturday, whatever schedule that's okay for you, but it needs to be regular. Kasi the algorithm needs to know na you're publishing regularly. That's one. Second, you have to organize it in playlist. Ayusin mo rin lang yung playlist. Hindi mo pa yata inayos yung playlist mo eh.
Hindi ko alam yung playlist. Sige.
Howard, paging Howard.
Ayusin mo lang yung playlist.
Playlist, tapos yung URL. I-google ko na lang yan, how to make
tapos yung URL. Kasi once na maayos mo yung URL, para I know you, lagi kang nag-appear. So you just tell them youtube.com/ganyan. Dr. Gaile or whatever you want.
Actually, when I started nga my channel, sobrang na-appreciate ko yung mga, like you guys, it's so hard to make content I swear. For me, that's the hardest. To think of what to write, what to make a video, yung pinakamahirap for me. Kasi pag nagawa mo na yun, madali naman mag-video and edit. Yung pinakamahirap yung content. So like, for example, for you guys, that you make a lot, sobrang na-appreciate ko talaga. It's hard. It's very hard. Grabe. Ikaw, regularly eh. Kasi every time I check your vlog or your blog, meron eh. So parang akala ko madali lang. Pag ginawa mo na, shucks, ang hirap pala. And you take photos, diba? And you review. So, yeah, I really, kudos to you guys. Galing.
Oo, thanks. And pwede kang maging international natin. YouTuber.
Well, isa pa yun eh. Like ako kasi my videos are Taglish eh. Kasi I find it's more effective.
Okay yun. Okay din yun.
Nung nag-publish kasi ako ng pure English, parang
social.
Or hindi siya masyadong nag-resonate sa mga diba? I
Oo,
guess it's
Taglish.
different.
Okay,
Yeah. I
Taglish.
guess it's
Oo.
different. If you target, I guess kasi I get also suggestions na parang if you want daw to capture international viewers, you should make it pure English. But
I think naman you always have to think about the value you provide
oo,
to the
'di ba?
internet.
Yun nga. Oo nga.
So, yung ano lang naman yung English or Taglish kasi most of our audience naman are Filipino. So,
Yes.
to that. It matters lang with the advertising money.
Oo.
It's mas mataas yung yung English only. Pero that's secondary na eh. You have to always
Think of
focus
your
on the audience eh.
Mm. Oo.
Yung audience mo. Okay. Galing. Thank
Thank you.
you. Hopefully
Thank you. I
magkakita
learned a
tayo.
lot. I learned a lot from you guys.
Oo. We learn a lot
Diba?
from you guys. Oo. Kailan kaya tayo kakain ulit kay Mama V?
Oo nga, I know. Oo, ang tagal
Bawal
na.
daw eh. Bawal pumunta sa kanya, di ba?
Bawa ayaw niya. Ayaw niya muna. Pag ano, syempre, we're all being cautious. Oo,
Oo.
hanggang ano na lang, phone calls, ganyan.
Okay. All right. Thank you.
Thank
Thank
Okay,
you,
you.
thank
guys.
you.
Thank you. Thank you to Tina also.
Bye-bye.
Bye-bye.
Oo,